Back to Studio 4, everyone. Physician shortages are becoming more and more common in this country. Those shortages are often felt more significantly in communities like ours. You see, rural areas like the Panhandle requires healthcare support from a variety of resources. Many times physicians come from abroad to practice or get their specialized training. So I wanted to bring in Dr. Brian Weis today, the Regional Dean of Texas Tech University Health Science Center School of Medicine here in Amarillo, to talk about these healthcare providers and why they're so critical in terms of increasing access to care. And I know that you're big supporters of that, of getting these doctors.
Yeah. So, and, you know, if you look at estimates, and there's different numbers, but if you take the American Association of Medical Colleges, they're saying we're looking at possibly at 86,000 physicians short by 2037 in this country. And so it's going to disproportionately affect rural areas or typically underserved areas. Because again, a lot of those doctors want to be in the big city. They're still here. So this is a major concern as to how we can address this shortage.
So how do you get them here? How do you recruit them?
So we do a couple things. First, you know, one thing, we have training programs here. So we have our residency programs. A lot of times we bring in not only American medical graduates, but we bring in these international medical graduates. So it's estimated that between 1 in 4 and 1 in 6 residents in the United States actually trained overseas and then come to the United States to continue training or even assume jobs here. So again, a lot of these international medical graduates are very valuable providers in our community.
So how do you guys go out and recruit those specific doctors to come here to fill those resources?
They apply for our programs. A lot of them are looking for the opportunities we have in the United States. Now, what they are dependent upon are these visas. And obviously you've heard a number of things about visas. There's really 2 visas we see primarily for those who are training. A lot of times they come on what's called a J1 visa. That allows them to train. Now, the problem with the J1 is they have to go back to their own country for a couple of years after they train. Now, however, they can apply for what's called a J1 waiver, meaning they can have that requirement waived if they serve an underserved area in this country. So we see a lot of our residents graduate, and they may go to an area that's underserved to get that waiver so they don't have to return to their own country for a couple of years. And then the other one is the H-1B visa, and that's the one that we have some of our faculty
I hear that a lot, yeah.
Right, and that's the one that recently there's been some talk about trying to have a fee associated with that. But, you know, we are very dependent on these doctors who come for H-1B visas. They serve these communities well, and in the process, they're trying to go through the immigration system to go ahead and get permanent residence or even citizenship.
Right. So if those programs were to go away, the communities impacted the most are going to be rural communities like ours.
Yes, yeah. And I think if you look at, you know, the medical staff at both our hospitals, I'd say at least 50%, if not more, are these international medical graduates, and they're wonderful doctors. I mean, they're well trained. They come here, they become part of the community. They serve the community tremendously, and yeah, but we are totally dependent on these doctors and to take care of folks in towns like Amarillo or underserved areas.
Well, Dr. Weis, we always appreciate having you here, and I think most importantly, just having the Texas Tech University Health Science Center here in our area. It is such a boon for our medical community, and man, I can't imagine.
Well, thank you. We've been here 50 years and have no plans to go anywhere else. So,
good.
So yeah, this is good.
50 years.
Yeah, so we're good, and that's our mission. Is we want to train the future nurses, doctors, pharmacists, physical therapists for this community.
All right. Well, we appreciate you. Thanks for coming in, and we'll be checking in again with you soon. We've got more coming up after this.